let's go ahead and start your presentation. I just want we've got Native Patient Navigators, and we've got program managers, and we've got community health educators and community health workers all on here, and I think it would be nice for them to see what some of your programs are.
Okay.
There, so you've got it.
I have one that's just on my hard drive here. This one's called Breast Cancer Advisor or Breast Health Advisor, and this is just 4 stories, and it's all just sort of cartoon-like, where you have a little story, and then you have some multiple choice questions at the end. So it's basically a story that is built for educating patients. And it runs on the computer like a little cartoon. This is on the internet. There's a web address for it. I just don't have it right at this moment, but I guess Linda can put it up later, send you the link. And so you can use this as an educational teaching tool when you're in a group. In fact, I just did this last Saturday. There was a women's meeting at the American Indian Health and Family Services Clinic, which is the Urban Indian Clinic in Detroit. And we had a women's group meet there on Saturday and have a lot of fun, and also had some instruction on breast cancer stuff. And so I used this particular little web game to tell them about breast cancer. And since it's all more or less story-based and not just fact-based, it has characters in all the stories as well as the questions, then hopefully it will be retained better than when you just hand out facts to patients. You know what I mean? So you can, this is free, you don't have to pay anything for it, and Linda will provide the web address maybe in the middle of this presentation. I'll try to make the learning not too painful. So, what we're going to learn about today is breast cancer detection, of course using imaging. And this is beyond the mammogram, emerging technologies, and you may have already been hearing about some new stuff going on with join the conference. So we're going to talk about this a little bit so you'll understand what the old stuff is and what the new stuff is. So let's go back to basics. One of the fantastic events about breast cancer is that mortality has been dropping ever since 1990, which is pretty much the onset of modern extensive mammography screening programs and breast cancer screening and detection programs. So this is mortality rate. It's gone down every year and continues to go down even now, just a little bit, so it goes even beyond this graph a bit. And we think a lot of this drop in mortality rate means that 30% fewer women every single year die from breast cancer as compared to the past, in the days of your mothers and aunties. And so we believe that screening mammography has been around for a long time, and since the 70s, and it's really kind of the gold standard for judging other technologies because there has been so much published on screening mammography. This is another chart that again demonstrates mortality reduction in a different way. That last graph that I showed you was from SEER data. I think you're familiar with what SEER is and the SEER registry and how they track patients. And then this is from published studies. So this is a study where they put a whole bunch of well-done published studies all together from Italy, Netherlands, UK. So this is kind of worldwide information that demonstrates that mortality has dropped with mammogram screening by almost half. According to putting all these studies together, here you have 0.5. That means almost a 50% drop in breast cancer mortality with screening mammography. This is what's called a meta-analysis, when you put a bunch of studies together and pull them and then analyze them. So this is a meta-analysis of the effectiveness of mammogram screening. And here's another way to assess it. This is a computer modeling program where you look at the life years gained per 1,000 women screened. In other words, if women get screening mammography, how many years of their life does it save? And you get the most years of life gained, that's 189, when you do annual mammography between the ages of 40 to 84. So it's kind of like the more mammograms you do, the more life years gained in a population you'll see. Compare that to if you only do mammograms every other year.
Join the conference.
I don't know what slide number we're on, but maybe you can catch up to us on this power. Oh, you're there, I guess. You're already seeing what I'm seeing, yes. So, if you do a mammogram every other year, just in women ages 60 to 69, then you'll only gain 49 years of life years improved. But that's because women of this age don't have that much longer to live, whereas if you start screening at age 40 and you save a life, you've saved a woman generally 40 years. And this was just published in 2012, so this is computer modeling based data. And this also demonstrates that the mortality reduction, in other words, risk of death has dropped by 40% if you do mammogram screening between ages 40 and 84 every year. So mammogram seems to be pretty good. And then we've done many years of the old-fashioned film mammograms. You know what those are? Those are like photos from an old-fashioned Polaroid camera, kind of like that, film mammograms. But we changed over, or most places have changed over to digital mammography, which is digital, just like your digital cameras are. And this digital mammography that happened about 2005 was a small improvement over film because we found that we could detect cancer a little bit better with digital mammograms, and especially ductal carcinoma, we were seeing that earlier. And ductal carcinoma in situ is a very early form of breast cancer before it gets to be invasive. So it's good to detect that early. You can generally have a 99% survival if DCIS is excised early and treated. So I've been telling you about the wonderful successes of screening mammography, but then of course there's kind of the dark side. It's not perfect. It's just like us as humans. We're great, but you know, we're not perfect, and that's how screening mammography is also. Even with digital mammography, about 25% are falsely negative. What that means is of 4 women who have cancer, and if they all get mammograms, one of those 4 women, the cancer will be invisible and not seen on her mammogram. So that's why palpation still exists, and that's why palpation has not gone away, because mammography is not perfect. Very human in that regard. Additionally, when we do screening mammograms, you know that about 1 out of 12 women, or 8%, are called back for more imaging of some kind. And the majority of those turn out to have nothing. So this is, in a way, false positives. We're calling people back from screening for additional imaging, and it turns out to be nothing. So they had all that anxiety over something that was normal. And finally, when we do biopsies of abnormalities found on mammograms or ultrasound, the majority of all of our biopsies are benign. So that means most biopsies are normal and not cancer. So now I know you're starting to think, wow, can't you guys do better than this? Well, the fact of the matter is this is about as good as we can do with the technology that we have, and with all the efforts that we have. This is the best practice that we can have to detect the most amount of cancers as early as possible and try not to miss big ones, but we still miss big ones. So we've known that this is a problem with mammography for a long time, despite its substantial successes. And here's mostly where the problem lies. It lies in the problem of what we call the dense breast. And a dense mammogram, which this is an example of right breast, left breast. This patient doesn't even have a terribly dense mammogram. She's got sort of like halfway dense. Dense means the whiteness. See all the whiteness in here? This glandular tissue. This is the tissue in your breast that makes milk that feeds babies. And some people have a lot of it, and some people don't have very much of it, but it's white. And when you have a lot of it, you have a very dense breast. So about not quite half of all women have what you might call dense breasts that makes breast cancer harder to detect. Now this is an MRI on that same patient I just showed you. Here's the patient. These mammograms were called normal and negative. Now because this patient has a high family history risk of breast cancer, she also got an MRI. And on the MRI, there's this small cancer here in this left breast that was invisible or not detectable easily on the mammogram. Shall we go back and see if we can see it? You want to try for that? And I'll show you where it is. That was right here. That's pretty tough, isn't it? It's hard to see anything there. So, the problem with the dense mammogram, I don't know, it's like my grandson's Lego table. Maybe some of you have grandsons, and maybe they have Legos, and the dang Legos go everywhere, if you know what I mean. And my grandson has a Lego table where all his stuff goes. And on this Lego table, there's a little Christmas tree. And if I asked you to find the little Christmas tree, I think you'd have a lot of trouble doing it. This is a black and white image, just like a mammogram. It's a cluttered image, just like a mammogram. And it's a two-dimensional image of what is actually a three-dimensional object. So things can be hidden under anywhere, and you just can't see them. Maybe the Christmas tree is here, or maybe it's in the box, who knows. But then when I show you the Christmas tree is right here, then you go, oh yeah, obviously that's the Christmas tree. And of course, if this image was in color, Christmas tree is green, you have no trouble finding it at all. So this is an analogy of the problem we have with the dense mammogram. There's a clutter, and there are hidden abnormalities. So as I told you, breast density is caused by glandular tissue, and if you have a dense breast, you have about 4 times greater risk of having breast cancer than a woman who has what we call a low density or fat density breast. A breast that is all fat, has very little glandular tissue, and less glandular tissue to form breast cancer. Also, as I showed you, the mammogram is less sensitive to finding cancer when you have a dense breast. So I'll show you some examples. Here is a woman with a very dense breast. It's all white, and cancer is white. So good luck finding white inside of white. In a mammogram like this, we will find cancer only half the time. We just can't see it the other half of the time. So 50% sensitivity. Okay, this breast is not quite so dense. There's much less of the white glandular tissue here. You can see the veins, you can see the arteries. Can you see the cancer? Not really. Still in a breast like this, you can find cancer about 3/4 of the time, 75% of the time, but 25% of the time you won't see it. Finally, anybody can see the cancer in this breast. This woman has a low-density breast that's all fat, and here's the cancer right here. That's obvious to everyone. If you have a mammogram like this, you can detect breast cancer early at least 95% of the time. So no problem finding cancer if everybody had breasts like this. But everybody doesn't.